Now, right now, Colorado experiencing what is considered very high flu activity, along with all kinds of other illnesses and bugs going around. Joining us now to talk about all of it is Dr. Linsdey Fish. Doctor, thanks so much for being with us. We appreciate it. Dr. Fish is an internal medicine doctor and the medical director at the Pena Family Health Center Urgent Care Clinic. And we appreciate you spending a little time with us today.
Thank you. Happy to be here.
Yeah, so much so. We are seeing so many people get sick. I know a lot of people here in our newsroom have been sick. I know so many of my family and friends have been sick. We always talk about washing our hands, but what can people do to avoid getting sick?
Well, you highlighted the most important part, which really is washing our hands. We've all heard it, but we need to wash our hands with soap and water for at least 20 seconds. Or if we're using hand sanitizer, use something with 60% alcohol in it. Additionally, the other thing we need to do is avoid touching our face. We all touch our face all the time without even paying attention to it, but that's really how germs can spread easily. Last things I always recommend is disinfect high-touch areas like door handles, workspaces like computer keyboards, and our cell phones. And lastly, if you're around somebody sick, try and minimize the contact with them. You don't want to share cups with people who are sick or shake hands with them.
Does it matter if you use spray or wipes when you're cleaning like your workspace? Does it make any difference, or are they both just as effective?
Yeah, both are pretty effective. Certainly, I think the wipes are better, but you got to do a good job wiping.
Gotcha. Can't miss anything. All right, if someone is still thinking about getting that vaccine, because I know we always push it out in the early, kind of late fall time. If somebody still wants to get a vaccine, is it still smart to do so?
Absolutely. We are recommending the flu vaccine if you have not received it this year. Colorado and the nation is experiencing the worst flu season in the last 15 years right now. And the influenza vaccine does a fantastic job at decreasing severe illness like hospitalizations and deaths. And so if you can have that on board before you get infected, you're going to feel a lot better and not have a bad outcome.
Yeah, we're not just talking about a certain age group, right? Because I know a lot of young people that have flu really bad, enough to where they've had to go to the emergency room worried about it.
It is true. And unfortunately, our pediatric or our children this year are having a tough year with it, and we are on par right now to see a highest level of pediatric hospitalizations from flu again in more than many years. And so we recommend influenza vaccine for anybody 6 months of age and older.
When should you go see your doctor?
So people are really familiar with flu-like symptoms, so that's pretty common. The people who are at higher risk for complications are going to be young children under the age of 5, adults older than 65, and if you have any chronic medical conditions like diabetes, heart disease, lung problems like asthma, and lastly, if you're pregnant too, you should get checked out. And if you're not any of those people, but you start feeling severe shortness of breath, chest pain, or confusion, absolutely you need to go get checked out.
Yeah, don't take any chances, right?
Absolutely.
Be cautious. Dr. Fish, thank you so much for being with us, and we're going to see a lot more of you here First Step Forward. We're looking forward to that.